Good evening, everyone. My name is Prarthana Kanagaraj, and I'm a student from Alliance Academy for Innovation. Today, I am beyond excited to share with you how predictive AI has been revolutionizing the early detection of endometriosis, offering hope and solutions to millions of individuals around the world who have long suffered from its delayed diagnosis and inadequate care. A little bit about me is that I'm a senior currently working towards getting my EMT certification in order to gain hands-on experience in emergency medicine and patient care. At school, I serve as the Vice President of Operations for our HOSA chapter. HOSA is a student-run organization for healthcare aspiring individuals. Through this organization, I help lead initiatives that empower over 300 students interested in health sciences. Outside of school, I actively volunteer and intern at senior living centers and local clinics, where I support both healthcare staff and patients. These experiences have deepened my commitment to a future in medicine and community health. So what exactly is endometriosis? Endometriosis is a chronic condition where tissue similar to the lining of the uterus grows outside the uterine cavity, causing inflammation, pain, and often infertility. It impacts approximately 10% of individuals assigned female at birth, which is around 190 million people worldwide. Despite its prevalence, diagnosis typically takes over 6 years on average, resulting in prolonged suffering, infertility challenges, and significant economic burden. This diagnostic delay highlights a critical global health inequity in reproductive care. So the current diagnostics that are being used include transvaginal ultrasound, also known as TVUS. TVUS is non-invasive, but it may miss subtle lesions. They also use MRIs, which are better at visualization, but they are costly and not universally available. And then we have laparoscopies, which are gold standard with surgical confirmation, but they are invasive and very resource intensive. So while these conventional tools are accurate, they're not yet ideal for early accessible diagnosis. Currently, researchers at the University of Adelaide created a new technology called Imagendo, which combines TVUS and MRI with machine learning to detect endometriosis with specialist-level accuracy. The team also developed HiCom, a human-AI collaborative multimodal multi-rater learning model. And this system refines noisy labels, leverages both T1 and T2 MRI, and integrates clinician feedback, yielding better classification than just AI or human alone. Imagendo is projected for a clinical rollout within 2 to 5 years and is currently expanding globally. A study at Rutgers RWJ Hospital used deep learning, including ResNet, EfficientNet, and DenseNet, on TVUS data from around 100 subjects. They achieved an AUC of 0.85 to 0.9, demonstrating strong diagnostic capability from ultrasound alone. In 2023, a scoping review evaluated 33 AI-based models designed for endometriosis diagnosis. These models leveraged a range of data types, including imaging like MRIs and ultrasound, blood-based biomarkers, genetic profiles, and clinical records. The review reported pooled sensitivities ranging from 82% to 97% and specificities between 71% and 92%, demonstrating that AI systems can accurately identify endometriosis across varied diagnostic inputs. This highlights the versatility and potential clinical utility of AI in reducing these diagnostic delays. Beyond imaging, machine learning uses clinical variables like dysmenorrhea severity and IBS history to predict superficial peritoneal endometriosis with recall of around 79% and a specificity of around 74%. The advantages of using AI in the diagnosis of endometriosis include that it reduces this delay in being diagnosed with it from years to potentially months. It's also non-invasive and cost-effective, which means that it can be scalable globally, even in low-resource settings. And its collaborative models ensure transparency and expert oversight. However, with any solution comes its limitations, and some potential limitations include data limitations, specifically how the small homogeneous data sets limit generalizability. Then there's also clinical adoption, which means that it requires integration into workflows and regulatory approval. And then you also have bias and equity, which means ensuring that diverse training data and there's an access to this training across demographics. So our call to action is that in order to advance this field, we must fund large multi-site validation studies of these AI tools and integrate AI-guided imaging into reproductive health systems. So it should be something that women are tested for during their annual checkups after the age of 18 using these AI models. Then develop training and policies for adoption in global settings. These methods involving AI-powered diagnostics offer a transformative path toward earlier, safer, and equitable detection of endometriosis, improving lives worldwide. These are the references that I used for my research. And before ending this presentation, I would like to thank the entire team at Johns Hopkins University for promoting global health and providing students with the opportunity to engage, learn, and contribute to meaningful change on a global scale. And of course, thank you all for listening to my presentation on my research, and please feel free to reach out to me either through my email or my LinkedIn for anything. Thank you so much.